My first exposure to Memphis Orthopedic Group was not as a patient, but as a vendor. I started shooting video for Memphis Orthopedic Group back in 2011. And after one of the video shoots for Dr. Lochemes, he asked me what I thought would be a good idea for a next video. And my idea was to take a patient from beginning to end, from initial consultation and diagnosis to treatment to prognosis to whatever you can think of in between to resolution. He thought that was a good idea and asked me if I had any recommendations on how to start. And I said, well, we can start with me. And he kind of gave me this look, well, what are you talking about? And I said, well, about 5 years ago, I had an injury playing basketball where my knees just hurt after every game. And then it got to be where they not only hurt after the games, but continued to hurt and hurt and hurt throughout the week. And then it got to be where it was just a chronic issue. Dr. Lochemes did an x-ray, and when he put it on the viewing board, I could even tell that there was something wrong with my knees. And he said, yeah, Bob, I hate to tell you this, but it looks like you've got arthritis. And here I was, 38 years old, and staring at arthritis. And he actually said, you have the knees of someone 10 years older than you. He suggested using a shot called Synvisc 1, which is a synthetic synovial fluid or synthetic hyaluronic acid injection that goes into your knees and helps relieve the pressure. And I tell you, it was one of the most amazing things that I had ever experienced. On a scale of 1 to 10, I was probably about an 8 or a 9 when I went in to see Dr. Lochemes. And he gave me the 2 injections, and by the time I left the office, my pain had gone from an 8 or a 9 to about a 3 or a 4. And he said, you know, he gave me the expectation, don't expect that over the next 2 or 3 days, but after that it may settle in and you'll start feeling better, and they can last up to 6 months. Well, they ended up lasting about 13 or 14 months, which I was ecstatic about, because in that 5-year time frame, I was not able to go and play with my kids outside the way I wanted to play with my kids. I coached my daughter's t-ball team and then my son's t-ball team, and even coached basketball for my son, and was not able to do what I think was an effective job because I couldn't run with the kids. Now I could. I also couldn't work out. I was pretty strong in my legs. When I would do my leg extensions, I was able to do almost max out the machines. If the machines went up to about 250 pounds, I could max that out. And then at the height of my pain, I decided I would push through it, but I was only able to do about 30 to 40 pounds maximum without the pain just getting so excruciatingly bad that I couldn't bear it. Well, after these shots, I've been able to go back up to about 160 pounds, and I'm not having any pain other than the pain of lifting weights, which is normal and actually kind of feels good after a while. Dr. Lochemes, to me, does a great job of being really personable with his patients. I feel like I could just talk to him as a friend, not just so much as a doctor. He sits down, asks me questions, values my input, and then takes everything that he knows and based on everything that I tell him, and comes up with a you know, that, I guess that assists him in making a diagnosis, but it also helps him put together a plan for me that not only he believes is going to be effective, but is going to be something that I can live with. It's not going to be something that's going to be too much for me to do, or something that's going to be impossible, or something that's going to be a drag for me to do on a day-to-day basis. It's something that I'm going to be able to work with and live with, and not just me, but my family's going to be able to work with and live with. Thanks to Dr. Lochemes, I've been able to get back my life, at least for the time being, and start enjoying my family and start enjoying my life and doing things that I enjoy doing.